You're listening to C103's Cork Today podcast. Phone and text lines are currently closed.
Health store, Times Square in Ballincollig, where Anneliese joins me. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
And a huge number of questions, so we'll do our best to get through as many of them as we can. James says, would Anneliese have any advice for the treatment and prevention of angular cheilitis in the lips? Also, my nails have become very brittle and split very easily, and I'm not sure if they're connected or not. And I've checked it, it's to do with the splitting of the lips.
Okay, so it could be down to a couple of different things, Patricia. There is actually, lips do split very much if you're deficient in a particular one of the B vitamins. So taking a B complex that's high in vitamin B2 might help with that. That splitting often happens more at the corners of the lips as opposed to the lips themselves. And the nails being brittle as well, I'm wondering, has this person come through a period of being very run down or being very stressed? Because actually often your nails and your skin and your lips will all suffer in those cases. Dry lips are very common for people at this time of the year, and a lot of people use the lip balms on them. And that's very good to protect them. But I sometimes think, Patricia, it doesn't actually get the fat into them from the inside out. So sometimes I think maybe taking a fish oil during the winter months just to keep your skin kind of hydrated with fats can help. That's not going to be a quick fix, though. That will take a little bit of time to kick in. The best lip balm I've ever found is one called Eco Lips. Now, it can be quite difficult to get them. I know that we can no longer get them in the shop. So if you can get your hands on those, they're fantastic and they definitely do hydrate. The other thing that's very good for sore lips as well is the Biopropolis cream. It's fantastic if you've got chapped lips, but also for cold sores, it definitely takes the pain and the anger and the redness and the swelling out of the cold sores. So you could try that as well. And then the last thing I'd say on weak and brittle nails, this could be a question I'd often ask customers if they had a lot of heartburn and acid reflux. Because if you've got low stomach acid and a weak valve at the top of the stomach, you get all the symptoms of heartburn. But because you've got weak acid, you're not very good at digesting proteins, and this affects the quality of your nails. So sometimes people who've got very brittle or ridged nails, it can be an indicator of low stomach acid, in which case we'd supplement with a digestive enzyme with some stomach acid in it.
Wow. Any suggestions, please, for cold hands and feet? Is it just down to poor circulation?
Mostly, I think. Now, there's another thing that it can be as well, Patricia, and that's called Raynaud's disease. This is a kind of an autoimmune disease, and they're not really sure, like they don't really understand it very, very well. But what happens with Raynaud's disease is that cold temperature shuts down the very tiny little capillaries that make their way out to the tips of our fingers and our toes. And of course, because they shut down, they're not bringing any blood and nutrients to nourish and warm the tissue. So people's fingers can go very, very white. So if it's something that's serious, maybe go to your doctor and get a diagnosis. Now, there's nothing much they recommend for it, truthfully. So what we normally recommend is to support the circulation. And the things that are best to support circulation, the horseradish and garlic is a lovely one in the wintertime. Viridian do one of that. Hawthorn is another fantastic one that's very good for the health of all of that tiny, very delicate vascular tissue in the capillaries. So you can also get hawthorn on its own, or hawthorn and a garlic complex as well. And we would definitely recommend taking those. Some people find that using an oil with capsaicin, which is the extract of chili, that can help by rubbing it into the hands. But I mean, just be very careful with that on the eyes, Patricia, because that can be very stingy. The only other thing that it could be down to, if it's an all year round thing as opposed to a winter thing, it can sometimes be a symptom of a low thyroid, because thyroid would be responsible for metabolism and circulation in that roundabout way. And if you had other symptoms like low energy, putting weight on, and finding it very, very hard to lose it, thinning hair, sluggish feeling overall, and fatigue, then it could be something like low thyroid, so get your bloods checked.
Okay, talking of bloods, the listener said, my recent blood test showed my iron levels are at the lowest point of normal. Could Anneliese advise what I should take? I do eat a lot of green vegetables.
Green vegetables are a great source of iron, Patricia, but they're not always the best source of iron for some people because the iron isn't like the active form that we use. The best sources of iron actually is red meat. Particularly liver is a fantastic one. Now, a lot of people don't like to eat red meat for health reasons. So in that case, I think you probably need to up your intake of green leafy vegetables and make sure that you're taking them with something vitamin C rich at the same time. So that could be things like peppers or tomatoes. Green leafy veg will have some vitamin C as well. Actually, surprisingly, potatoes with their skin on are a great source of vitamin C, and sweet potatoes would be a good source of vitamin C. So that can help improve iron absorption. And if that doesn't work, you could take an iron supplement. The best iron supplement really to avoid being constipation is one called iron bisglycinate. It's very, very gentle on the system. And if your iron is only borderline, I wouldn't take it every day. I maybe would take it maybe twice or three times a week just to keep yourself topped up. And that certainly will have no negative side effects whatsoever. Now, another reason that you could be low on iron, and this happens very regularly, Patricia, that people eat plenty red meat, but they're still low or borderline low on iron stores. And this always indicates to me that they're not absorbing iron. And that can be sometimes in the case of gluten intolerance or maybe not digesting and absorbing your food very well. So taking a digestive enzyme could help. And if you feel that you've other symptoms of gluten intolerance like bloating or digestive issues, maybe consider that could be a cause as well.
Yeah, that's exactly what happened to me. It's how I discovered as soon as I gave up and went on a gluten-free diet, the iron part of it sorted itself out for sure. Okay, hi Anneliese. What was the topic that you suggested for tiredness and no energy last week? Probably the Source of Life Gold, was it?
I think Source of Life Gold is always a great tonic, Patricia, because it's got everything in there. But also the thing that gives you that little instant boost of energy is ginseng. I think that's what I might have been talking about. Ginseng is a wonderful and gentle herb to kind of get an energy boost. It gives you an immediate sort of feeling of energy without that kind of caffeine jitteriness that you get from a caffeine boost. So the one I love is there's a Terra Nova one called Dynamic Synergy, and it's a blend of a lot of different types of ginseng. So you get a really nice, very significant but gentle, non-jittery boost of energy. The other lovely thing about ginseng as well is that it is very nourishing and restorative for the adrenal glands. So it's great if you're going through a period of stress, either mental stress or busy life stress. So it supports you through that as well without wearing you out.
Okay, Sean he can't shake off a cold and he has a sinus infection with it. He's taking probiotics, he's on a good multivitamin, he eats healthily. Any other advice and you hear that a lot of people trying to just shake off a cold and a sinus infection is just lingering.
Very much so. And actually a lot of people have very bad lingering sinuses and colds after having had COVID. So I think a couple of years ago as well, Patricia, I do remember having a long cough myself, and a customer of mine telling me that had been dubbed the 100-day cough by consultants. So wow. I'm wondering if that kind of nasty cough is around again. In terms of the sinus infection, what I'd recommend for that and for anything respiratory is the Dr. Dealish Clare Mucotone, because it is great. It's a blend of herbs that kind of support a healthy respiratory tract, but also there's immune boosting herbs in there and herbs to kind of reduce mucus. So you could take that 3 times a day. Another thing that's great for sinus infection is to do a steam inhalation with some oregano oil in there. Oregano is a really strong herb for killing off any kind of bacteria or fungi or anything that could be up there in the sinus cavities. So you could do that once a day. Start off easy with that oregano oil because it's very, very, very strong. So start with maybe 1 or 2 drops and try and build up your resistance to the strength of it. So that could be another thing to do. I definitely would take something like N-acetylcysteine, which is fantastic for anything kind of mucousy, chesty. It's a great natural anti-inflammatory as well, so it's very, very supportive of immune system function. And there is a supplement we have in the shop that I love. It's by Nature's Plus, and it's a combination of vitamin A, C, E, zinc, selenium, and N-acetylcysteine in there. So you're kind of getting all of your immune supporting ones all in the one tablet. So something like that could help. And that's probably the very basics, Patricia, I think.
Okay. And very finally, you have less than a minute for this, for Bernice, who describes herself as a coffee drinker all of her life, which she's noticed over the last 2 months when she drinks coffee, it seems to upset her stomach. Why would that be happening?
Yeah, so caffeine is actually is very much loosening of the sphincter muscles, which a lot of people will know because they'll take it to help themselves go to the loo. But there is a very tight sphincter muscle at the top of your stomach, and caffeine can loosen that. So you will get maybe a little bit of an acidic feeling. So I suggest cutting down on the caffeine. Zinc carnosine is a supplement that is very good to help support the stomach lining and to help tighten up that little valve if you've got any symptoms of kind of acid or acid reflux. So she could try taking that for a month or two as well.
It can be dreadful to have to give up the old coffee. Okay, listen, Anneliese, have a good week and we'll chat to you again next Monday. Look after yourself. Thanks a million. That is Anneliese Dressel of the Health Hub Times Square in Ballincollig, and Anneliese on our own website, healthhubstore.com, will put up as heard on the radio. And she'll do that later on, and our own John Paul will put it up on c103.ie as a separate podcast.